Fibrocystic breast changes are a common benign condition characterized by lumpy, tender, and sometimes painful breasts. Affecting millions of women worldwide, this condition is neither cancerous nor directly linked to an increased risk of breast cancer, but it can cause significant discomfort and concern. Understanding fibrocystic breast changes, what causes them, their signs and symptoms, how they are diagnosed, and the available treatments can empower women to better manage their breast health and seek appropriate care. To begin, let's explore what fibrocystic breast changes are. The term fibrocystic refers to the presence of fibrosis, or thickened rubbery tissue alongside cysts, fluid-filled sacs, within the breast. These changes are part of a spectrum of benign breast alterations that occur naturally in many women, particularly during their reproductive years. The condition is so prevalent that some experts consider it a normal variation rather than a disease. While some women may remain unaware of these changes, others might experience noticeable symptoms, especially around their menstrual cycles. The exact cause of fibrocystic breast changes is not fully understood, but hormonal fluctuations, especially those involving estrogen and progesterone, play a significant role. Each month, as a woman's body prepares for a possible pregnancy, her breasts respond to varying hormone levels by enlarging the milk glands and ducts and increasing the amount of breast tissue fluid. For some women, this process leads to an exaggerated response, more pronounced swelling, the accumulation of fluid, and the development of fibrous tissue and cysts. Over time, this can result in the characteristic lumps and discomfort associated with fibrocystic breasts. Genetics may also influence susceptibility. Women with a family history of fibrocystic breast changes are more likely to experience them themselves. Other contributing factors are less certain but may include lifestyle influences such as caffeine intake, dietary habits, and stress levels. However, no single factor has been definitively proven to cause fibrocystic changes, and the interplay of hormones remains the predominant explanation. Recognizing the signs and symptoms is key to distinguishing fibrocystic breast changes from other breast conditions. The most common symptom is the presence of lumps or areas of thickened tissue in one or both breasts. These lumps are usually described as rope-like or nodular and tend to be movable rather than fixed. The texture may feel grainy or rubbery to the touch, and the lumps often fluctuate in size and tenderness throughout the menstrual cycle. Some women report that their breasts feel particularly lumpy, swollen, or tender just before their period, with symptoms subsiding afterward. Pain or discomfort, known as mastalgia, is another hallmark symptom. This pain can range from a mild ache to a more intense, sharp sensation. It might be localized to a particular area or felt throughout the breast. In some cases, the discomfort radiates to the underarm or upper arm. Swelling and a feeling of fullness are also common, and some women may notice clear or slightly cloudy nipple discharge, particularly when pressing on the affected area. However, any new or unusual nipple discharge, especially if it is bloody or occurs without pressure, should be evaluated by a healthcare professional. While fibrocystic changes are typically benign, it is vital to remain vigilant. Any new lump, persistent pain, skin changes, or nipple discharge should prompt medical evaluation to rule out more serious conditions, including breast cancer. Women should familiarize themselves with the normal look and feel of their breasts, performing regular self-exams and reporting any changes to their healthcare provider. The process of diagnosing fibrocystic breast changes begins with a thorough medical history and physical examination. A healthcare provider will ask about the nature, duration, and timing of symptoms, as well as any relevant family history. During the breast exam, the provider will carefully palpate the breasts and surrounding areas to assess the size, consistency, and mobility of any lumps. Imaging studies are often used to gain more information. A diagnostic mammogram, which uses low-dose X-rays to create detailed images of the breast, can help differentiate between benign and suspicious findings. However, dense breast tissue, common in younger women, and those with fibrocystic changes, can sometimes make mammograms more challenging to interpret. In such cases, ultrasound is a valuable tool. This non-invasive test uses sound waves to distinguish between solid masses and fluid-filled cysts, providing additional clarity. If a lump is found to be a simple cyst, meaning it contains only fluid and has smooth, regular borders, no further intervention may be necessary. However, if the imaging results are inconclusive or show features that raise concern, a biopsy may be recommended. This procedure involves removing a small sample of breast tissue or fluid for examination under a microscope. Most biopsies confirm the benign nature of fibrocystic changes, but the procedure is essential for ensuring accuracy and peace of mind. Once a diagnosis of fibrocystic breast changes has been made, treatment is tailored to the severity of symptoms and the individual's preferences. For many women, reassurance and education are the primary interventions. Understanding that fibrocystic changes are benign and not linked to a significant cancer risk can provide considerable relief. When symptoms are bothersome, several strategies may help. Supportive bras that provide adequate lift and minimize movement can reduce discomfort. Over-the-counter pain relievers, such as acetaminophen or non-steroidal anti-inflammatory drugs like ibuprofen, can alleviate pain and swelling. Applying warm or cold compresses to the breasts may also offer temporary relief. Lifestyle modifications are sometimes recommended, though evidence for their effectiveness is mixed. Some women report improvement with a reduction in caffeine intake, found in coffee, tea, chocolate, and some soft drinks, though scientific studies have not consistently confirmed this benefit. Similarly, decreasing dietary fat or increasing intake of certain vitamins, such as vitamin E or B6, has been suggested, but results vary. Regardless, maintaining a balanced diet and a healthy lifestyle is always beneficial for overall well-being. For women with more severe or persistent symptoms, medical therapy may be considered. Hormonal treatments, such as oral contraceptives, can help regulate menstrual cycles and reduce breast tenderness in some cases. Other medications, like danazol or tamoxifen, have been used to relieve severe pain, but their side effects often limit long-term use. These treatments are generally reserved for women who have not responded to other measures and whose quality of life is significantly affected. In rare instances, if a cyst is particularly large or painful, a healthcare provider may recommend aspiration. This minor procedure involves using a fine needle to drain the fluid from the cyst, which can provide immediate relief. If the cyst recurs or if the fluid is bloody, further evaluation is warranted. It is important to emphasize the ongoing need for breast self-awareness and regular screening, even after a diagnosis of fibrocystic changes. Women should continue to perform monthly breast self-exams, ideally at the same point in their menstrual cycle each month, to detect any new or unusual changes. Regular clinical breast exams by a healthcare provider and routine mammograms, as recommended by age and risk factors, remain cornerstones of breast health. Living with fibrocystic breast changes can be challenging, particularly when symptoms interfere with daily activities or cause anxiety about breast cancer. Open communication with healthcare providers, education about the benign nature of the condition, and shared decision-making regarding treatment options are essential components of effective care. Support from family, friends, and patient groups can also help women manage the emotional aspects of the condition. In summary, fibrocystic breast changes are a widespread, benign condition driven largely by hormonal fluctuations. The key features include lumpy, tender breasts that often change with the menstrual cycle. Diagnosis relies on a combination of clinical assessment and imaging, with biopsy reserved for uncertain cases. Treatment focuses on symptom relief and reassurance, with medical therapy available for more severe cases. By understanding the causes, recognizing the signs and symptoms, seeking timely evaluation, and implementing appropriate management strategies, women can maintain control over their breast health and reduce the impact of fibrocystic changes on their lives.